A very good evening to one and all present here. I proudly present myself, Vishal Tulsimani, along with Dr. Abhirami Girikrishnan as a host for tonight. Whatever that's fractured in life will come at place given the sustained amount of training. I take immense pleasure in welcoming you all on behalf of Indian Medical Association Medical Students Network Tamil Nadu to this live Q&A with an excelled bone surgeon. We are joined by Professor Dr. F. Abdul Khader sir for this session. With the increased use of automobiles, we see increased cases of road traffic accidents in our day-to-day lives. It is very essential for us to know about the field and people who fix those broken bones. In 1741, a French physician and writer Nicolas Henry wrote a book called Orthopedia, or The Art of Correcting and Preventing Deformities in Children. Henry invented the word orthopedics by combining the Greek words orthos, which meant straight, and paidion, which means child, because the specialty was originally meant to focus on correcting musculoskeletal issues like polio and scoliosis in children. Thus, orthopedics is actually the original word to describe the practice that is now a bit broader in scope. Like the other branches of medicine, remarkable technological advances have significantly shaped the field of orthopedics in recent years, and not just being a field of treating fractures and deformities in general. From the advancements in arthroscopy to exciting cellular research to stimulate the growth of ligaments and bones, orthopedics is really venturing into the developments of upcoming future. I hereby ask Dr. Abhirami Girikrishnan to welcome the guest speaker. Over to you, ma'am.
Thank you, Shal, and good evening, everyone. Dr. F. Abdul Kader, sir, is a vibrant and a dynamic orthopedic surgeon, always enthusiastic to explore the new frontiers in orthopedic surgery and surgical techniques with 15 years of experience. Always passionate to teach, he always looking to simplify the teaching learning process for young undergrads and postgrad learners, and is constantly seeking to find new and innovative teaching methods. Sir is currently working as the Ed and Professor at Department of Orthopedics at Sri Sathya Sai Medical College and Research Institute. He's an alumni of the illustrious Karnataka Medical College. After completing of his MBBS, he was selected in the MS program in Annamalai University and did MCH in the University of Seychelles, American Institute of Medicine. He has organized many cadaveric workshops for interns, postgrads, and other surgeons at college, state, national, and international level. He is a reviewer of Indian Journal of Orthopedics, Journal of Orthopedics and Joint Surgery, is the official journal of Tamil Nadu Orthopedics Association and Clinical Journal of Orthopedics. We feel proud to have you with us today, sir. We welcome you, sir. And finally, I would like to welcome all the viewers for today's session. I would like Dr. Abul Hasan, sir, to give a few words along with Dr. Kadir, sir, and along with Raghunandan Ramanathan, sir, to give a few words before we begin the session. Over to you, Dr. Abul, sir.
Thank you very much, Abhirami. Good evening, all of you. The speaker of the day, Dr. Abdul Kader. Welcome you to the session, sir. As chairman of Medical Students Network, Tamil Nadu State, I'm very happy to say a few words in the beginning of the very, very important academic event today. At the outset, I congratulate Charan, Abhirami, and Vishal for having taken up this very important task. As you all know, academic excellence and research are one of the important verticals in Medical Students Network. Our boys in Tamil Nadu, boys and girls, are doing excellent work in the academic front. My job is only to, encourage them in the pursuit of learning, pursuit of excellence in learning, and also excellence in educating. In the same direction, we are going to have a very important and innovative programs in the forthcoming TIMACON conference in December 17th and 18th. We have envisaged some important, very innovative workshop like treatment of sports injuries, poisoning, research, and suturing skills development, and also paper presentation. I am very sure that the present motivation prevailing among our medical students, we will see more number of academic events in the coming year also. And I wish all our guys who has joined this particular webinar have a nice day. And also thank our guest speaker, Dr. Abdul Kader, for having accepted our invitation and participating in the Q&A session on bone diseases. Over to you, Dr. Over to you, Abhirami, and thank you for this wonderful opportunity.
Thank you, sir. I now request Dr. Abdul Kader, sir, to give a few words. Over to you, sir.
Thank you, Abhirami Krishnan, and thank you, Dr. Vishal, and of course, thank you, Dr. K.M. Abul Hassan, sir. So, I'm honored here. Thank you very much, sir. And good evening, everyone. First of all, thanks to our Indian Medical Association and of Medical Students Network for this opportunity to give me a guest live talk in question and answer session to share my experience and to share my knowledge with you people. Thank you.
Thank you, sir. I now request Dr. Raghunandan Ramanathan, the State Conveyor of Indian Medical Association Medical Students Network, Tamil Nadu, to give a few words, and then we'll begin the session. Over to you, sir.
Thank you. Good evening to all the people who have gathered here, and also my thanks to Dr. Abdul Kader sir for accepting the invite today and joining with us for the question and answer session arranged by Indian Medical Association Medical Students Network Tamil Nadu. I thank Dr. Abul Hassan sir who has taken his time to be part of the inaugural session of this question and answer session, and you guys are doing really a wonderful. Thank you, Abhirami, for organizing this session, and in future we will make sure that it reaches more and more people, and more participants are getting inside this academic event organized by IMA-MSN Tamil Nadu. And today, as already introduced by Vishal, today we are having more and more road traffic accidents every day, and due to that we have lots of newer problems as well as technological as well as technological advancements. And hello. Can
Hello, Dr. Dinesh.
Yeah, muted. Yeah, so as RTA is increasing, we have more technological advancements as well as more problems to be solved. And yesterday, December 3 is a day of international Day of Disabled Persons, and I guess we are at the right time organizing this Q&A session for benefit of the people. As this year theme says, transformative solution for inclusive development, fueling accessible and equitable world. We as a physician, as budding medicos, we have to bring in more solutions and more focused on how we are improving the patient care of those patients who are having a disability post RTA. So I think this session will be useful for everyone. And once again, thank our today's speaker, Abdul Kader sir, for taking his time and his energy to come here and discuss with us. Thank you so much, sir. And
thank you.
Thank you, Raghunandan sir. Now I request Dr. Charan, State Secretary of Indian Medical Association, along and the in charge for event subcommittee for IMA-MSN to give a few words. Over to you, Charan. Sharon?
Am I audible? Yeah.
Yeah, you are.
Yeah, good evening to one and all present here. First of all, I'd like to thank Abul Hassan sir for giving us this opportunity to host this event. And thanks Abdul Kader sir for coming up and helping us in this initiative. And a great thanks to Abhirami ma'am for having the start of doing this Q&A. And I hope this benefits many people, and ortho is one such department where each one of us goes at least once in a lifetime. So it's and many myths are around there, and many people just carelessly leave off stuff like Puttur Kata or some other stuff. So many myths will be broken today by Abdul Kader sir, and we are looking forward for it. Thanks a lot. Thanks a lot, sir.
Abhirami, you're not audible.
Thank you, Sharon, for the words, for your speech. Khader sir, with your permission, can we start the session, sir?
Yeah, please.
Okay. The first question, how do you face the day-to-day challenges in your life as an orthopedic surgeon? And over to you, sir. I mean, how do you face the day-to-day challenges in your life as an orthopedic surgeon, sir? Over to you,
Thing
sir.
is that it is actually say it is very tough actually. See, nowadays people comes with pre-mindset. For each and everything, they search in the Google first. After that only they'll come to visit doctors. And they used to say that avoid painkillers, it will affect kidneys. But the fact that there is no term called painkillers in medical pharmacology and medical terminology. It is a non-steroidal anti-inflammatory drugs. Not only NSAIDs have side effects, but all the medications have. We are using for its effects only. So people consume more junk foods, frozen foods, and more carbohydrate foods like rice items, roadside locally oily fried samosas and bhajis, and even alcohol, which are the most dangerous thing in the world, will affect the kidneys. Not only kidneys, but every organ in the body. And some people will come and ask, one of my known person had the same kind of fracture, hand fracture, but you treated with the plaster, and you are asking me to operate, go for a surgery. Yeah, go for a surgery. So answer is that fracture to fracture treatment varies. So according to the fracture pattern, displacement, extension, union, etc. So there are some examples. I mean, these are some examples for the day-to-day challenges that we are facing. To convince the patient is very, very tough. Over to you, Abhirami. You are mute. Your speaker, Abhirami, your speaker.
Thank you, sir. Thank you, sir. It gives us an idea of how difficult the profession is and a glimpse of handling the challenges, sir. But moving on to the next question.
Yeah.
Why do you think someone takes or have interest in orthopedics as a profession? And what moment in your life made you choose orthopedics as a profession, sir? Over to you, sir.
Yeah. During my UG time, I was interested in surgical field actually. So when I doing my internship, during first, 1 month of ortho posting, I learned to apply POP and reduction of fractures and of course suturings. Suturings I like to do more. So I was very happy to see patients with good results. So hence I preferred ortho in my PG life. Over to you, Rami.
I'm sure everyone of us will have a moment in our lives, sir, which will inspire us to choose our profession, sir. Moving on to the next question, sir. Describe your journey as a postgrad in ortho, sir. Over to you.
I finished MS Ortho in 2006 in Annamalai University. I was blessed with great mentors. So Professor C.S. Krishnamurthy sir, Professor Neelakrishan sir, and Professor Sendilnathan sir, and Professor Gandhimati madam, and Dr. Prabhakaran sir, and Dr. Aravind sir. So during my PG time, they let me to do perform all the surgeries under their supervision, and they taught me each and everything clearly and very well. So without them, I'm nothing. Because of them only, I became a good orthopedic surgeon. Thank you. Over to you, Rami.
I hope we tried our best to make you relive your moments, sir. The next question, what are some of the rare orthopedic cases you have encountered in your career and how do you manage them? Over to you, sir.
Rare orthopedic cases. It is actually tough question, mark. Thing is that there are many rare cases in my career. So, but I can remember at present one series of cases, yes. That is total calcanectomy. See, for calcaneal osteomyelitis, below knee amputation is the treatment of choice. But after the treatment, patient should depend on walk only with prosthetic limb and with walker or crutches. After limb amputation, a limb amputation is a traumatic experience for the amputee, but it is also a challenge for the recipient to get used to a new situation, to reach his or her greatest level of independence and go for a deep depression. But total calcanectomy can prove a reliable option for limb salvage. It is a limb salvaging procedure. Given well-designed heel raise footwear after the surgery, patients with total calcanectomy do well at any age. Calcanectomy is an uncommon amputation, so that may provide better quality of life than other more proximal amputation like Sims amputation, transtibial amputation. After calcanectomy, patients were able to remain independent. That is the main thing. Patient will do everything independently. Almost more than 10 cases I have performed till now, and they are doing very well. Over to you, Brahmi.
Thank you, sir. We are privileged to learn it from you, sir, as it make us the case beforehand. Make us learn the case beforehand. To the
Yeah.
next question, how far multivitamins and supportive therapy tablets are useful? Is it necessary to take these tablets for our day-to-day life living? Over to you, sir.
Multivitamin and supportive therapies is for the support, only for the support, additional support. So these are not the main drugs or main treatment. So consuming balanced, healthy diet, routine, regular walking, exercises, and lifestyle modification, of course, may reduce the intake of these tablets. But you can take nothing wrong in taking tablets, multivitamin and supportive therapies. But see, more than everything is wrong for our life. So maximum, if it is possible, you can reduce. So instead of that, we can take healthy food, all those things. Thank you. Over to you, Brahmi.
Yes, sir. It goes for most of us, sir. We will take a note of it and apply in our lives, sir. Next question. How to manage osteoporosis? What are the suggestions to control osteoporosis in our Indian population? Over to you, sir.
Yeah. Osteoporosis. It is a well-known term for everyone. See, reduction the bone density due to many reasons. So mainly in elder age group. So prolonged desk job and not following ergonomics strictly and improper unhealthy diet, less exposure to the sunlight and clean air and lack of exercises. So these are the factors. So what all the things to do? So what we supposed to do? So daily do routine regular walking, exercises, proper healthy diet, and supportive therapies and lifestyle modification, etc., and will improve the thing. So osteoporosis is a disease, and we can modify that properly. Over to you, Brahmi.
This is one of the most faced crises during these times, sir, and it's the most useful now than ever, sir. Moving on to the next question. Is osteoarthritis preventable? How to manage it if it occurs? What are the treatment modalities available? Over to you, sir.
Osteoarthritis. No, it is not preventable. It is also age-related conditions. So some of the thing here also the same thing. So daily regular routine activities, exercises, proper healthy diet, and supportive therapies, lifestyle modification definitely will improve osteoarthritis. So according to the stages and severity, so we can go for physiotherapy and supportive exercises. If it is the knee pain, quadriceps hamstring exercises, spinal extension exercises, all those things we can do. If needed, we can give intra-articular injection. And if it is a stage 3 or 4 maximum, we can go for a joint replacement orthoplastic surgery. So osteoarthritis, it is not preventable actually. We can reduce by doing lifestyle modification, exercise, healthy diet, all those things. Over to you, Abraham.
This is really was very helpful, sir, as we have relieved to know as there are many methods to treat it. To the next question. Prevalence of vitamin D deficiency in India is esteemed at 94%. What do you think of the challenges faced by orthopedicians, and how do you think this could be overcome? Over to you, sir.
Okay. Thing is that the main culprit for this is COVID-19. So because of COVID-19, we people didn't go anywhere outside. We are there in the home only. And okay, we doctors know, but everyone to do this job in the home only. So they started doing work from home, and their job pattern and timings. More people are working in the night. They are sleeping actually. So they are because of their timing and job pattern are the second thing. So same here also. So vitamin D3 is a main source. It is a source from sunlight. So go for regular routine walking and exercises. Same proper healthy nutritional diets and supportive therapies if it is needed. So definitely to do lifestyle modification. If you are doing night duties and stay early in the morning and walk and sleep off, that's it. Definitely that will improve.
Okay, sir. This is a frequently asked question, sir, and as we know, we are indeed happy to know it, sir. So moving on to the next question. We see many cases of road traffic accident with multiple injuries and multiple fractures. What is the order of priority in the injury to treat them? Over to you, sir.
So for this, main thing is priority is first we have to, that is a universal law. First thing is to stabilize the patient. A, B, C, as you know. So airway, breathing and circulation, that is the first priority. Second treatment, we can go for neurovascular injuries. If any damage in the neurovascular thing, first they have to repair that second. And third one is limb salvaging procedures. So limb salvaging procedures we have to perform if it is needed. That is third one. And fourth, we can go for lower limb fracture procedures. So to avoid embolic complications. So first, main thing is to stabilize the patient first. So second is neurovascular. Third will be limb salving procedures, and fourth lower limb procedure. Then we can go for upper limb, all those things, extra procedures. And fourth is mainly lower limb procedure to avoid embolic complications. Over to your friend.
We really hope everyone understands the seriousness of road traffic accidents, as this is a lot happening nowadays, sir. I hope people will be aware of it and safe too. The next question. Fractures are one of the most common cases seen in orthopedics. How do you think ortho has evolved in newer techniques for fracture treatments? Over to you, sir.
Okay. See, advanced diagnostic modalities like X-ray to rule out even a minute fractures. So high definition CT to rule out fracture patterns and extension of fractures and bone tumors. So high Tesla MRI shows clear image of ligaments, tendons with any tears. So it became easy to diagnose clearly, first of all. So diagnostic modalities are improved advancedly. So recent advancement in plating and nailing of multiple options with proper advanced instrumentations, and also of course with guided C-arm techniques, everything make us easier to compare to old era. Yeah, over to you, Abdul.
Yes, sir. So these techniques will help reduce the suffering of patients. Hope this will be useful to all.
Yes.
Next question, sir. We commonly come across people looking to native treatment for fractures instead of an orthopedic doctor. What do you think of this practice and what challenges you face with the complications and management of this treatment? Over to you, sir.
It is a very good question and very important question too. See, in olden era, there were no orthopedic doctors. So people used to go to only native bone setters. If it is undisplaced fracture, the alignment will be good and the union will be good. So many malunion, non-union cases are more common in our old era. In our earlier era, anatomical reduction achieved only by orthopedic doctors. So as they know osteology, morphology, anatomy, and structure of the bone, and how to reduce the bone, what are the ligaments surrounded, what are the nerve root, what are the muscles attached. So they know everything. Because of that, they can do anatomical proper reduction. But many people visit native bone setters, even though many people used to go to native bone setters because of their poor knowledge and uneducated thing. In recent advanced era, our digital era, so even educated people visiting native bone setters because of their poor knowledge. Post-natively, many patients used to come with non-union, malunion, and deformity, and compartment syndrome, and nerve palsy, vascular compromise, infections, stiffness, skin lesions, etc., etc. There are many complications in native management. So this should be avoided actually. So visit proper orthopedic surgeon for your bone related issues. Don't go to native bone setters.
Thank you, sir. Those are some of the great ways to cope up with the situation. Moving on to the next question. Many patients come to an orthopedician only after an unavoidable condition. In your point of view, do you suggest regular checkup with an orthopedician? Over to you, sir.
Yes, of course. See, previously old age started at 60 to 65 years. But now in new normal digital era, the old age starting at 40 to 45 years. Shocking, right? Yes, this is the truth.
Yes, sir.
Yes. So because of our prolonged desk job, so not following ergonomics properly and improper diet, less exposure to the sunlight and lack of clean air and lack of exercises, all those things. See, after 40 years, every individual must take master health checkup every year. According to the problems, they have to visit concerned specialty doctors. If it is an orthopedic problem, they have to visit proper orthopedic doctor. If it is cardiac problem, they have to visit proper cardiologist. Accordingly, we have to manage the thing.
This is one of the most frequently asked questions, sir, and hope it helps all of us. Going on to the next one. Can you shed some light on the latest surgical advancements in orthopedics, sir? Over to you, sir.
Yeah, in orthopedic surgery, there are many recent advancements in implants with the multiple options. And of course, daycare procedure, caver and all, we can put daycare and morning patient admitted and evening we can send the patient out. So with the caver procedures and there are antibiotic cementing. Previously, there was no antibiotic cementing, only cementing was there. Now, antibiotic cementing, we can control the infections too. So arthroscopic keyhole surgery and minimally invasive MIPO technique surgical procedures, and of course, robotic surgeries and recent advancement in diagnostic modalities. So all those things are happening. So as I told earlier, so there are the digital X-ray for even minor fractures, high definition CT to rule out my very small bone tumors even. So high Tesla MRI to see the very minimal tear also we can find out. So all those things are there. And of course, in operation theater, C-arm is a digital C-arm that is fully guided. So accordingly, we can, the latest techniques are improving day by day. It is improving actually.
Thank you, sir, for enlightening us, sir. Moving on to the next question. Post-op infections are very common after any surgery. How do you face this challenge and how do you do to prevent them? Over to you, sir.
Yes. Surgical first thing is infection. Complication is initial and first most complication is infection. So we have to reduce that first. So first of all, we need to have proper sterilized, well-maintained, well-equipped operation theater, number one. And number two, knowledgeable operation theater staff, OT staff, must. And patient's hygiene. Patient should have proper hygienic thing. And patient attenders should follow the hygienic conditions and restrict visitors till suture removal, according to me, so that the infection rate will be reduced. So drastically.
Your answers are extremely helpful in providing clarification, sir. Moving on to the next question. There's a general notion that orthopedics is a male-dominant profession. How do you view the rising trend of female doctors taking up orthopedics as a career in India? Over to you, sir.
Yes, like OG female dominant thing, maybe orthopedics is a male dominant one. Okay, thing is that it is good to see a rising number of female orthopedicians. Even in our department, there are 3 PGs, new PGs. So happy to see them all. So thing is that as I already mentioned, my mentor is Professor Gandhimati madam. So she used to do very well surgery. So she used to do everything fine. Orthopedicians, like that only it should be. Okay, who used to perform very good surgeries and very knowledgeable person. So females are more welcome to orthopedic department.
You helped us break that stereotypical ideas which has been developed earlier. A lot of women are now aspiring to become an orthopedician.
Yes.
Thank you, sir.
Thank
yeah. The last question for today's session. MS orthopedics, is it an end specialty or is there more to it? Over to you, sir.
Medical field is never ending field, ma. So there is no full stop for this field. So MS orthopedics is somewhat end specialty, but more are there to read and to learn. See, there are many certificate courses, fellowship courses, AO courses, and MCH orthopedics, etc. There. See, what we are following is MS orthopedics is a textbook. And there are textbooks, okay. That is not sufficient. Day by day, we are learning, and I am learning day by day. Each and every day, we are learning with new things. Okay, it is never finding end.
Thank you, sir. There are people who are aspiring more, and will be useful for them, sir.
Thank you.
Coming to the end of the session with a note of thanks. It was indeed an extremely enlightening session for all of us. I'm sure that the session proved to be an eye-opener for the audience. On behalf of the event subcommittee, I thank our guest speaker, Dr. F. Abdul Qadir, sir, for taking time off from his busy schedule for joining us today. Thank you, sir, for patiently answering all our questions in a detailed yet simpler manner, which could be comprehended by all. I would like to thank the Indian Medical Association Medical Students Network, Tamil Nadu State Council for supporting the event throughout. I would like to extend my special thanks to Dr. K.M. Abdul sir, President-elect of 2023 IMA-MSN TNSB, Dr. Prashant, National Council member and co-conveyor of Indian Medical Association Junior Doctors Network, Tamil Nadu, and Dr. Raghunandan Ramanathan, sir, State Conveyor and Dr. Shruti Pugarindi, co-conveyor of Indian Medical Association Medical Students Network, Tamil Nadu, and Dr. Kiran for their continued support. I would like to thank the technical team and the public relations team for helping us teaming today's event and advertising the event. I extend my gratitude to all the viewers who joined us this evening, without whom this session wouldn't have been possible. Lastly, I would thank the members of the event subcommittee, Indian Medical Association Medical Students Network, Tamil Nadu, for their efficient work in executing the event within a short span of time. It was a great pleasure to host this event today. This is me, Abhirami Girikrishnan, along with Vishal, signing off for today. Thank you all. Thank you, sir, for accepting our invite and coming live with us today, sir. It was a great honor to be share the screen with you, sir.
Thank you.
Thank you, sir. Gopal?